Hi, this video is about acute lower back pain, measures you can take to improve it, some of the medications and activities that you can and can't do. Acute means fairly rapid onset that can become quite intense as opposed to chronic back pain that people have had in the background over many years. I've previously written a blog on my website, please visit it, where you can read about common causes of back pain and ways to find relief. But today's video is more about the acute back pain where you don't have nerve entrapment or any pain shooting down the legs, any weakness in the legs or numbness, just simply focused in the back. If you do have any of the above, there are other videos on my website and on my YouTube channel, but that's when you should seek medical attention. Well, it's usually caused by strain in the muscles that surround the spine, and often that can be secondary to wear and tear of some of the joints around the spine. Sometimes a disc can tear, and although it may not herniate or compress a nerve, some of the inflammatory fluid in the disc can leak out and cause acute pain locally. And then another cause of pain discussed in another video I've done previously on my channel is sacroiliac joint pain, this region of the back here where the pelvis meets the spine. In most patients, these symptoms usually settle down anything from a few days to a few weeks, and the big debate has always been previously, should you rest up the spine, or is it safe to get on with normal activity? And the answer is actually the worst thing you can do is sit on the couch all day and lie around waiting for it to get better. The spine is a dynamic structure consisting of bones, joints, ligaments, tendons and muscles that surround it that all need to move. And there is good evidence over the years that getting back to normal activity as soon as you can, moving around, gentle exercise is way better than trying to rest it up. If it hurts, does that mean I'm doing it any harm? Well, not at all. It will hurt in the beginning, but you're not harming yourself at all. So it's important to get back into that as soon as possible. In terms of medications you can take, start off with the simple over-the-counter stuff. So paracetamol, up to 4 times a day. So 1 gram or 2 of the 500 milligram tablets taken no more than 4 times a day. And then in addition, you can add ibuprofen, which is an anti-inflammatory drug. Any of the muscular inflammation or joint inflammation in the spine, it can actually suppress it, and that's 400 milligrams up to 3 times a day. These have been shown to be quite effective, but because they are over-the-counter medications, there's this perception from patients that they're not effective, and that in itself can have a negative effect, and that's been shown to have a negative effect in how effective these drugs can be, but the studies have shown they are effective in alleviating some of the pain. Thereafter, there are other medications you can take if that's not quite covering it, which do require a prescription. That's a good thing, because if you're not really getting through the pain with these drugs and some exercise and things are getting worse, you should be seeing a doctor anyway, and that's why these other drugs need a prescription. Often paracetamol gets swapped out for cocodamol or codidromol, and that's basically paracetamol with codeine. Codeine is a much stronger opioid type of drug, so you've got to be cautious with taking too much of that. You can become dependent on it if you take it chronically, and it can cause constipation. Ibuprofen, that I mentioned earlier, can cause stomach irritation and indigestion, so if you're known to have stomach ulcers and things like that, it's best to avoid it. You must seek the advice of your doctor. And then there are some neuropathic type of painkillers, which I tend to avoid when you've got back pain alone, and only use these when you have sciatica, i.e. nerve pain going down the legs. And these are drugs such as gabapentin or pregabalin. They're old-fashioned anti-epileptic drugs. They work by slowing down the signals that travel up and down nerves to the brain, but they do have significant side effects, including drowsiness. And then another painkiller that can be useful, particularly at night time, is amitriptyline. It's actually an old-fashioned antidepressant, tricyclic antidepressant. It has a similar type of effect in reducing the nerve pain. All in all, the sooner you start to get moving, just gentle walking around to start with, and very simple exercises better, and try and get back into your normal activity. I try to avoid raising anxiety in patients by being too prescriptive about what you can or can't do. If you don't have pain radiating down the legs, and the pain itself wasn't caused by trauma, i.e. something that struck you or a car accident or anything like that, most of the time you're not going to harm yourself by just trying to get back into simple activity, and it will settle down. If the pain persists for more than a few weeks, starts to get worse, then it's time to seek medical attention. If you found this video helpful, please subscribe to the channel for more videos on the different procedures we do and the different conditions of the spine, and to keep up to date with upcoming videos of useful information about spine health, looking after your back and treating any problems you may have. The goal of the Spine MDT is to find the least invasive solution that also gives you the longest lasting result. We're able to do this by working with a team of physiotherapists, osteopaths, pain specialists and surgeons in one network. Please check out our website, call us or email us, and we'll be very happy to help you. Thank you.